Hello, everybody. A lot of people are scared when they hear the term universal health care, and a lot of times it's linked in the media to things like communism, socialism, and Marxism, which is why people get that fear. I would dare to say that everybody in this room has been significantly impacted financially by a medical bill at some point in your life. One of the consequences right now of the healthcare system in the United States is the high out-of-pocket costs that people have to pay for co-pays, deductibles, etc. And on top of that, you have to pay insurance premiums just to get that insurance in the first place. I'm going to give you a brief history of the United States healthcare system. I'm going to talk about the current costs that exist right now in the healthcare system and give you a potential solution. Doesn't mean everybody's going to agree, but it's kind of a middle ground solution that is possibly better than the one we have in place right now. Healthcare in the United States has been a hot button issue for a long time. The history dates back to the early 1900s, and the Public Broadcasting Service put a timeline together back in 2013 of the history of the healthcare system. In the early 1900s, the American Medical Association came into a national program. There was the first time it was organized medicine in the United States, and then doctors began charging for hospital fees, which was the first time that it ever happened. In the 1920s, corporations began providing insurance for their employees. General Motors was one of the first ones that did so. Many of us know General Motors to be a huge car manufacturer in the United States. And in the 1960s, there were over 700 companies in the health insurance market. Another thing that happened in the 1960s is Medicaid and Medicare were put into law, and Medicaid and Medicare provide insurance for the elderly, the disabled, and low-income families and individuals. All of us are concerned with how much healthcare is costing. Healthcare costs rose in the 1990s to double the rate of inflation at that time, which caused a lot of people to opt out of health insurance, period. About 16% of the nation completely opted out of insurance at that time. In 2010, the cost was $2.6 trillion for healthcare in the United States. This is according to Kaiser Family Foundation. A lot of this was due to unemployment rates that stemmed from the recession in 2007-2008, and then low incomes were created because of that, and then employer-sponsored family premiums increased by 97% at that time. The U.S. spends $8,233 per year per person on health care. This is 2.5 times that of France, Sweden, and the United Kingdom. There are fewer physicians in the United States per capita, and there are fewer hospital beds as well. Costs are expected to rise 70% over the next 10 years, according to the Social Security Advisory Board. By 2013, the projected cost per person per year will be $13,100. This is an increase of almost $5,000 per person. If implemented wisely, universal health care can be a cost-saving alternative that impacts everyone in a positive way. It's really important when thinking about changing a national healthcare system to look at what other countries are doing that is working. In a survey reported by the National Public Radio in 2008, it ranked countries according to different facets of their healthcare system. France was ranked number 1, while the United States was ranked 37. One of the reasons that France was ranked number 1 is because they have access for every single person in their country for good health care. There are no wait lists for elective surgeries or specialists, and there's a huge choice in doctors. Some countries who do a socialistic medicine or a communistic approach, you have one doctor you can go to. You have to wait for a specialist to open up appointments. In France, that's not the case. France is able to operate their system using several avenues. One, the first thing is they're funding their system through payroll and income taxes. We pay that anyways. 70% of the cost of the fees that are paid are provided by this national health fund that the payroll and income taxes go into. 30% is paid by supplemental private insurance, which is usually employer provided. Right now, many employers in the United States will pay a portion of the insurance premiums for their families to be covered. That would equate to that on France's system. They also use a government regulation of fees. Especially all the hospital fees are government regulated, And so the cost is actually lower than what it is in the United States, and hospitals don't get to set their fees. The other thing they have is doctors' unions, where the doctors across the country belong to a union and they negotiate doctors' fees. So there's a uniform fee scale across the board. So you don't go to one doctor and have one fee, and then if you have to go see another doctor, have a different fee you're expecting. It's all the same. There are no deductibles for people to have to pay. So a lot of people in the United States, they choose a higher deductible, $1,000, $2,500, because the premiums get lowered when you have a higher deductible. If you don't have a deductible to worry about, then you don't have to meet that, and you don't have to worry about the premiums because they're a set fee. The sickest in France are also exempt from copays. So if you have an illness like cancer, where you're constantly having to go have work done, blood work, tests, all of those things, that even small copays would add up to a lot of money. And prescriptions add up to a lot of money with the cost of the prescription drugs, and so they exempt those individuals from having to pay those copays. The results of this system is that in France, the cost is half of that of the United States to run. There's also lower administrative costs. One of the reasons for that is they do electronic prescriptions. This helps to avoid prescription drug abuse because they can track if a patient is coming in with a new prescription with something, the doctor can see exactly what their patient record is. It also helps with administrative costs because in the billing departments, you don't have to worry about the fee for this insurance company and the fee for this insurance company. It's across the board uniform. And another result is that you have a comparable quality of care. The rising cost of healthcare affects all of us, and it costs even more than we can account for on paper. Universal healthcare not only provides a better healthcare system, but creates a system that you don't have to fear the loss of a home, the loss of a job, the loss of personal property, or the loss of dignity if something happens to you or you become ill with a significant illness. Hopefully, the information you received here today will help you to at least know when you hear terms like universal health care that it maybe isn't as scary as you thought before, and there's a lot more to the system, and there is a middle ground approach to looking into that.